Hey, it's Mo Egger. This football season, no matter who you root for, no matter if it's college or pro, you can catch every game at Long Neck Sports Grill. They've got 4K TVs all over the place. And remember, the sound is on for every big game. And if you haven't tried Long Neck's wings, what are you waiting for? There's tons of other great stuff on the menu, and no place in Northern Kentucky has a better beer selection. Locations in Wilder, Richwood, and Hebron. Long Neck Sports Grill. Stay long. Come often. We do this every Wednesday, except last week we did it on Thursday, and the week before we did it on Thursday. We talk injuries, mainly NFL injuries, with one of the experts from OrthoCincy, Orthopedic Sports Medicine. The great thing about OrthoCincy is they've got specialists and locations across the tri-state. They also offer walk-in orthopedic urgent care weekdays from 9 a.m. to 9 p.m. and on Saturdays 9 a.m. to 1 p.m. You never need an appointment. Learn more at OrthoCincy.com. That's OrthoCincy.com. Joining us this week is Dr. Nick Early. Let's talk about Orlando Brown. So he suffers a knee injury in the second quarter against the Browns, leaves the game, doesn't come back. Starts the game last week, leaves, doesn't come back, didn't practice today. Originally, they thought it was something called tennis leg. That's not the case. It's officially been diagnosed as a knee strain. What things are we looking for when we make that diagnosis?
Sure. So, first off, the most important thing is that in a situation like this, structurally, his knee is in pretty good shape. There's certainly a lot of things that can happen that can, cause an injury to a knee that aren't going to be things that's going to make the knee unstable or in some situation where it's not safe to play. But that said, there can be situations where it can be pretty painful, or you just don't have the strength that you normally would, or the explosiveness doesn't feel the way it normally would. And it sounds like, when he came back in, he was playing, he just experienced, from a second injury, increasing discomfort and just didn't really feel like his knee was underneath him in the way that it was, he was really going to be able to perform at his, level where he's at. And oftentimes it can be one of those things where it can be like a day-to-day to week-to-week type of thing where, you can aggravate it again and it kind of sets you back. It can be a 2 steps forward, 1 step back process sometimes with injuries like this.
I guess my sort of overly simplistic way of looking at this says, well, they have a game on Sunday, then they have to turn around and play again on Thursday. He has missed much of the last 2 weeks. Does it make sense to just put him on the shelf, hope that he's more comfortable, and see if he can go out there a week from tomorrow?
I think that is certainly a consideration, especially if his performance is not going to be where it needs to be. If you're worried about, okay, we really want to have him for that Thursday game, and, he's not really 100%, do we really want to try to risk it? It really kind of depends on, how he's feeling, and it can be something you have to make those decisions on the fly.
Let's talk about T. Higgins, who obviously didn't play against Philadelphia, and unfortunately that's becoming a recurring theme, him missing time. It's usually his hamstring. That's what kept him out of action early this season. On Sunday, it was a quad that caused him to not play. I think we have folks who hear the word quad but don't necessarily know what the quad is or what it does. Can you explain?
Sure. So there's kind of a couple different things when you talk about hearing quad. It can mean different things. So we say quadriceps muscles. There's 4 different muscles in your thigh that help to extend your knee or straighten out your knee. And there's the big muscles in the front of your leg in that thigh there. And they come down and form a tendon that then is kind of attached to your kneecap. Okay, so, somebody could have an injury where they actually injure their quadriceps tendon and tear that. That's a terrible injury. We see that with a few different players, over the last couple of years. With the thigh, more often where a quadriceps injury is actually a muscle injury. And most of the time that's going to be like a muscle strain or, kind of pulling a muscle. That happens all the time. There's varying degrees of that too. It can be something like you even just get hit and you have a bad contusion or a bad bruise in that quad. You can kind of pull it and have a strain injury where, you can have a fairly significant amount of pain. It can be pretty limiting. It can be everything from, frankly, even tearing some of the muscle to just kind of stretching it a little bit. So there's a lot of variability there in terms of, what the injury could be. Once again, kind of what we're finding out here, it sounds like it's probably more of like a strain to his quadriceps muscle that's kind of just limiting him a little bit, and it's somewhat questionable exactly in terms of the timeline.
So he's obviously got a pretty well documented history of hamstring injuries. Is there a chance that maybe these two sort of things are related?
Not directly related in terms of one has directly led to the other. I would tell you that in athletes who, tend to be, pretty tight in terms of their muscles. Oftentimes they'll be more likely to have muscle strain type of injuries. There's some people that just have, especially those fast twitch type of athletes that are just, really, kind of tight in terms of their muscles. And so, it's one of those things where they have to spend extra time stretching and recovering and doing everything they can to kind of keep themselves from having these types of injuries. So in that way, I guess there's some relationship.
Dr. Nick Early from OrthoCincy is with us. Let's talk about Shohei Ohtani. Game 5 of the World Series is tonight. During Game 2, a guy who is must-watch TV as far as I'm concerned, he's trying to steal second base, and he suffers a shoulder injury. He comes out of the game. They do testing, and the manager of the team, Dave Roberts, says that he is dealing with a subluxation. I don't know what that is, so let's start with that. Is that the same as a shoulder separation?
So, there's different terminology we use. Most of the time we're saying the word subluxation. What we're saying there is that the shoulder joint has kind of, like the ball part of the ball and socket has kind of partially slid out of place or kind of slid into a position where it's not supposed to be, as opposed to like a full dislocation where the ball part of the ball and socket comes all the way out of the socket. It's kind of, sitting down somewhere it's really not supposed to be. So that's usually what the phrase is there. A shoulder separation, some people will use it to describe a subluxation, but more often we'll use that when we're talking about the joint that's between your collarbone and your shoulder blade, called your AC joint. And that's another thing that can frequently get injured if you kind of fall on your shoulder. But it's actually a little bit different area. So sometimes it's just a terminology thing. In his situation, it seems like it was more of a shoulder subluxation where when he was sliding, he put that left arm down on the ground and it kind of jammed his shoulder. And I think it kind of pushed his shoulder partially, out of place. And then, it didn't sound like it came all the way out. And just from looking, at the play itself, it didn't look like that occurred. But it was probably more of that.
So he still played. He came back and he played in Game 3. He played last night. I was watching the game, and as he is running the bases, he is holding his shoulder, so he is dealing with discomfort. What are the determining factors when you decide whether or not an athlete like this could play?
So once again, it kind of comes down to, okay, how much structural damage, is there? In this situation, I hope is, none to not much, nothing like too significant that's going to cause him to have some, complete inability to perform. So you go, okay, it's safe. So then can the person perform range of motion well? Do they have good strength? Can they, can he swing? Can he do the things he normally needs to do? At, some level that's a tolerable amount of discomfort that's not going to actually set him back, if you do, put him through that. Because those are considerations like, okay, do you rest him for a couple games and then, if you don't win, then you put him back out there. And there's lots of different things you're kind of making decisions based on that. But the biggest thing is, and from all reports, he's had good range of motion, good strength. His shoulder has been pretty stable. And so it's really just going to be a matter of, comfort. And obviously in the World Series, you're going to do everything you can to have him out there.
Yeah, no question about that. Awesome insight, man. Thanks so much.
All right, thank you.
There you go. There's our guy, Dr. Nick Early from OrthoCincy. I say this every single week because I believe it. The great thing about the people at OrthoCincy is they've got specialists in locations across the tri-state, including walk-in orthopedic urgent care weekdays 9 a.m. to 9 p.m. and on Saturdays 9 a.m. to 1 p.m. in Edgewood and Anderson. It's easier and cheaper, most definitely, than going to an ER whenever you have an urgent orthopedic injury. Go to OrthoCincy.com. That's OrthoCincy.com. Hey, it's Mo Egger. This football season, no matter who you root for, no matter if it's college or pro, you can catch every game at Long Neck Sports Grill. They've got 4K TVs all over the place. And remember, the sound is on for every big game. And if you haven't tried Long Neck's wings, what are you waiting for? There's tons of other great stuff on the menu, and no place in Northern Kentucky has a better beer selection. Locations in Wilder, Richwood, and Hebron. Long Neck Sports Grill. Stay long. Come often.